Hi, I'm Dr. Michael Jacobs, Chair of the Department of Surgery at Henry Ford Providence, both in Southfield and Novi, Michigan. First of all, let me welcome you to the Department of Surgery. The Department of Surgery has a rich tradition in graduate medical education and medical student learning environment. We gladly welcome your participation in the operating room and in the perioperative areas. The operating room is a very rich environment for learning, but there are a lot of moving parts, from the perioperative experience to the intraoperative experience to the floors. And it's very imperative that you understand that you are an integral role in all of these components. During the course of your rotations, you'll be exposed to multiple different disciplines, and each surgeon and each particular surgical team has individual idiosyncrasies. So while it may not be possible to understand each and every one of them, there are a few basics that you need to understand. In preparation for entering into the operating room and learning how to scrub, you will undergo training sessions with the opportunity to learn how to scrub, don and doff your equipment, and proper attire and behavior in the operating room. This will be primarily conducted in the Simulation Center down on the first floor in Providence, Southfield. Additionally, the perioperative nurses, particularly the perioperative nurse educators located on both campuses, will provide for you some additional instruction and to help you learn along the way. It is imperative for you to understand that these are fully trained professionals, in many cases who have been doing this for decades. So it's very critical that we rely on their experience and we understand their critical role in the nature of not just education, but ensuring quality and safety for our patient population. Additionally, it's imperative that you understand your role as a future medical provider. And for me, many of the things that I do today are things that I learned dating all the way back to my first or second year in medical school. So please make sure that you accept their collaboration and collegiality and understand that they're only trying to improve your quality that you provide to your patients. Prior to your introduction to the operating room, you may be asked by the perioperative nurse educators to do a refresher course, particularly if it's been several months or more since your initial prep course down in the sim lab. Please understand that they're just trying to improve your quality and to help you maintain a safe environment, not just for yourself, but for the patient, keeping in mind that the patient's most vulnerable time is when they're under anesthesia. So that is the point in time when we need to provide the most critical type of care. Believe it or not, many of the things that we teach in the operating room are mandated requirements established by regulatory agencies such as CMS. Therefore, it is imperative that all of us adhere to these guidelines. To begin, we should all maintain universal precautions at all times in all perioperative areas. As you enter into the operating room, you'll be required to wear a specific hat, shoe covers, and proper attire. At no point in time is it acceptable to wear any type of personal clothing into the operating room, and you should not be wearing scrubs into the hospital or out of the hospital, and certainly not into the operating room from home. Period. Proper attire for the operating room can be found in the locker rooms. Typically, you will find a hat, shoe covers, and clean scrubs. Additionally, if you have a beard, it needs to be covered such that all hair is covered in the operating room. The most important thing that we try to do is to maintain sterility during the operation at all periods of time, both during the entrance and exit of the room, as well as during the preparation of the patient and placement of the gowns and drapes. It's very important that you understand your role in avoiding some common mistakes. Some of these include walking between sterile operative fields without being in a gown or gloves. This is not acceptable, as you may contaminate the field. Typically, it is acceptable to walk either behind the anesthesia machine or behind the back table, but please keep in mind that the blue drapes are sterile and you should try to avoid them and give yourself plenty of room. Some cases have a lot of equipment and the rooms are small, so special attention needs to be made to these types of orientations. Additionally, some devices do not have blue sterile fields. For example, covers of certain devices such as X-ray equipment or certain probes, they may be lined by clear plastic and may not be so obvious. Another example of that is during the robotic instrumentation and the covers that are used for those things. So it's very imperative, when in doubt, just hold your hands in front of you and ask the questions. Hang on, so I don't. Masks need to be worn in the operating room and also at the time of your scrub preparation. It's very important that while you're even scrubbing your hands, you need to have a mask. Once you enter the operating room, be very careful and aware of your surrounding environment. It can be a very confusing and daunting experience during your initial time frame, but I assure you, you will become very comfortable within a very short period of time if you just follow these simple rules. When in doubt, just simply ask either the scrub nurse, the residents, or the surgeon for some advice as to where to stand and what to do. Eventually, you will feel comfortable. Once you've completed your scrub and are ready to enter into the operating room, it's important to understand that your hands, elbows, and wrists are going to be considered clean and they cannot touch any part of your body. Typically, especially when you're new, the scrub nurse or the scrub tech will don your gloves and gown for you to make it much easier. At no point in time should you reach for your own gown or reach for your own gloves until the scrub staff is comfortable with you doing so. Additionally, you should not walk through the operating room field, the center of the field in particular, unless you have a gown and gloves on. Movement in the operating room also should be minimized to avoid creating any type of particulate matter off of the floor. Once you're at the operating room table, please do not reach for the instruments off the Mayo stand. These should be handed to you directly by the nurse or the scrub tech. This is very important for multiple reasons. It helps to maintain a sterile field, it helps to maintain organization, and to avoid accidentally getting stuck with a sharp. Additional OR etiquette involves not reaching across the operative field, or ideally not crossing your hands or your instruments. Please do not take instruments off of the trays that are set up by the scrub techs or scrub nurses. Finally, and perhaps the most important, is to understand that this is a team effort and we all need to work and understand each other's roles, and we have a deep respect for the individuals that are in the room. It's very critical that it's important for you to understand as a student that you are part of the team, but that these individuals are also to ensure not just your safety, but the safety of the patient is the most critical point. Unfortunately, from time to time, people do get removed from the operating room. Most often, this is due to either tardiness to the operation, behavioral or professionalism issues, or just simply not following the rules. We certainly do not like to do this, but again, the primary interest is that of the patient. So please keep that as the main point of understanding. Once you've completed the procedure, when you are asked to place the dressings, please be mindful that the patient will want to see clean dressings, and it's just good hygiene. So do not place any bandages, binders, any type of other gauze on the patient with dirty gloves. And also, please do not reach for any of the tape dispensers with bloody gloves. This is not an acceptable practice, and it contaminates it and requires us to throw the device out. Finally, if you have any other questions, you can certainly reach out to the nurse educators, the circulator in the room, or you can ask the scrub nurse or the scrub tech for any particular advice. And remember, being kind to people goes a long way in terms of getting things done. Also important that once you're in the operating room, you ideally do not leave and enter through the main doors. Ideally, you should be leaving through the substerile room. Some operating rooms have their scrub sinks in the main door, so it is acceptable to enter through that at first, but after that, you really should enter and exit through the substerile rooms. It's not uncommon to have to change gowns or gloves, and in some cases it's required. For example, during certain bowel cases upon closure, you may be asked to change your gown and gloves during the procedure. The nurse can help you to doff your gown and gloves in a proper manner, and you may have to re-scrub.
Okay.
It's also very important to note that food and drink should not ever be brought into the perioperative area or really any patient clinical area. Furthermore, please keep your conversations about patient care very private and, if possible, in an area away from any corridor or hall or public place. These are all violations of HIPAA, and we want to try to maintain patients' privacy. In closing, I would just like to thank you for coming to Providence to learn about surgery and the process of how operations are conducted. It's very important to understand that the operating room consists of a team environment, all working towards one goal of ensuring outstanding patient quality and safety. Thank you very much for your time. You can certainly reach me at any time at michael.jacobs@hfhs.org, which is the Henry Ford email, or you can simply text or call me on my cell at 248-770-4662. Thank you very much.